Are certainly right now in this country out of the pandemic phase. Namely, we don't have 900,000 new infections a day and tens and tens and tens of thousands of hospitalizations and thousands of deaths. We are at a low level right now.
That was Dr. Anthony Fauci earlier this week describing where he thinks the U.S. stands in the pandemic. He is now clarifying those comments to make it clear he did not mean that the pandemic is over. In a statement to the Washington Post, he said, quote, "We're really in a transitional phase from a deceleration of the numbers into hopefully a more controlled phase in endemicity." So right now, the U.S. is averaging around 50,000 cases per day. Joining Morning Rush here in our studio to get some insight into these developments with the pandemic is Dr. Jane Morgan, Executive Director of the COVID Task Force at Piedmont Healthcare. Dr. Morgan, great to see you as always. So let's first focus on Dr. Fauci's message here and his comment that we are no longer in a pandemic phase. What exactly did he mean by this? Because I imagine some people hear that and say, okay, this is a free-for-all. I can throw away the mask. I can forget this ever happened, the last 2 years.
Yeah, absolutely, Alex. And I think what he's trying to convey is that we're moving from this fulminant phase where we're on all blast of surge and moving towards a more controlled phase where we have tools, we have medical therapeutics, we know how to manage our public health measures, and our caseloads are down, although in some areas they're starting to increase, but overall caseloads are down. And so this phase is the beginning of the endemic phase, and there is no particular metric for where you move from pandemic to endemic, but we are in that transition now.
So when people hear the word endemic, they may think of the common cold or the flu. What is the danger in almost equating the two?
So when you look at that, certainly the flu cases, let's just compare flu. Flu, we get, between 12,000 to 50,000 deaths per year. The flu is certainly not innocuous. And look at COVID. We have close to 1 million deaths in this country over 2 years. That is the biggest difference. It has been a very lethal virus and a virus that has mutated and had the ability to evade our medical therapeutics. We haven't seen that in any of our other viruses to date.
And as these days go on, this coronavirus, it's mutating day by day. So we need those vaccinations. But what are some of the things that could set back the progress that we have made so far?
Well, certainly if we continue to have pockets of outbreaks that then grow, super spreader events where people are not taking proper precautions. Endemic doesn't mean that it's over. In fact, endemic actually means it's still around, but we have the ability to use any tool that we need to control it. So if we continue to have super spreader events and continue to have these pockets where it continues to grow, these are all opportunities for the variants to continue to develop. And certainly in those who are unvaccinated, we have an increased risk of these variants develop, and we still see it's largely the unvaccinated who are dying.
Right. So I want to talk about COVID fatigue here, because I think with Dr. Fauci's comments, coupled with how people are just already tired, it's been 2 years of this. How optimistic are you when it comes to controlling this virus over the next couple of years? What does that world look like to you?
So I do have optimism, and mostly because we have tools, and certainly we have fought misinformation and disinformation, and people without scientific backgrounds have had huge platforms to undermine public health. And certainly we've also seen the CDC to some degree be challenged with communication, not necessarily their forte on how to communicate in this era of social media. So lots of lessons learned. But overall, I feel optimistic. We certainly have a higher level of immunity in our community. What that immunity really means, because we can see that variants can reinfect people. But we see in our report at least 75% of children have had an infection. Almost 60% of our population has been infected. That's going to provide some degree of immunity, certainly not to the degree of vaccines. We want to make certain that people get their vaccines. But overall, I feel hopeful, and we have continued to, unfortunately, not move forward as one, but we have stumbled forward to the point where we've reached this state of endemicity. And so we'll just have to take it. That's where we are.
So I I am going to be honest here. I don't get a flu shot every single year, right? When we start to equate this to something like the flu as far as, you know, how we have to live with it, right? Are you worried at all that people are going to then take that approach to the COVID vaccines or boosters? We know so many people still aren't vaccinated.
You know, and that is a concern. And I think we've really got to get around the messaging of science leading the messaging and not people with all other types of background leading this messaging. It could be that we will have to have annual vaccines. We see that this virus has the ability to be quite lethal. 1 million people in the United States is not inconsequential. And so an annual vaccine could be a part of what it means to be up to date on all of your vaccines every year. And to remember that this is not a singular virus, a singular decision, meaning any decision that you make for yourself doesn't just impact you. It's a plural decision. So any decision that you make for yourself, you essentially are deciding for others as well.
That is such a good point. All right, Dr. Morgan, Executive Director of the COVID Task Force at Piedmont Healthcare. Thank you so much for coming in today.
Thanks, Alex.
Appreciate it.